So when we think of air pollution, what we have to realize is that we all breathe as an adult about 10,000 liters of air every day. Out of this, our lungs very efficiently extract about 500 liters of oxygen. Now, when we look at the scope of this problem, what we have to realize is that from the day we are born till the day we die, our lungs are constantly working, providing us with this oxygen. And so anything that goes into our airways throughout the day has an impact not just on our general health, but also on every single organ system and tissue in our body. And when we look at the impact of air pollution, it has been found that while it's very easy to understand that it will affect people who have asthma, who have chronic obstructive pulmonary disease, who have interstitial lung disease, who have had multiple bouts of tuberculosis or other lung diseases, we also realize that it affects people with regards to their heart health. It's associated with heart attacks. It affects the level of strokes. It is associated with cancers, both of the lung and other organs in the body. It has been associated with depression, with anxiety. So, and when we look at the particulate matter that is there in air, and when it reaches our alveoli, our air sacs, we have to realize that it can reach our bloodstream. So when we talk about the impact of air pollution, it is really a very far-reaching impact. It is not just our lungs and our breathing that's affected, it's every single body part and every single organ and tissue that is affected by air pollution. So when we look at the impact of age, it has been clearly found that children below the age of 5, because compared to their body mass, their size of their body, the amount of air that they breathe, because they breathe faster than adults breathe, they take in a lot more air and expel more air. It's called air exchange is higher in children. Because this air exchange is higher in children, the impact of air pollution also, whether it is indoor air pollution or outdoor air pollution, is higher in children below the age of 5 than it would be for other age groups. Also, adults who are above the age of 60 or 65, because they have aging lungs, their lungs have been exposed to all kinds of things through the years, all kinds of what we would call insults or infections, inflammation, many other things, diseases maybe. They also tend to be more prone to the effect of air pollution. Now, besides this group, any other individual who has chronic diseases, the two main groups are people with chronic lung or pulmonary diseases and those who have chronic heart diseases, are more prone to the effects of air pollution than others. But having said that, anyone who has a chronic ailment, something that has been going on for months or years, is more prone to the effects of air pollution than others. When we look at people who have even, for example, mental health disorders, something that you wouldn't commonly associate with air pollution, it's been found that if they are in a highly polluted area versus they are moved to an area that has very clean and fresh air, we see that their mental health effects also are reduced by air pollution. So it's very interesting to see that there are different groups, but realize that air pollution even affects healthy people who have absolutely no diseases. So there is no age group that is safe, there is no age group that is unaffected. So when we think of the symptoms of air pollution, there are some that are very obvious, such as increasing cough, some degree of breathlessness, or in a person who's already having lung diseases like asthma, COPD, ILD, they can have wheezing, breathlessness, difficulty breathing, shortness of breath with activity, and even people who are otherwise healthy may experience some coughing, mostly dry. Also, the risk of respiratory infections increases when the air pollution levels go up. So we see children getting more respiratory infections, we see adults and senior citizens getting more respiratory infections. So catching a viral infection and then taking longer to recover from the viral infection, where cough, phlegm, which is mucus production, increasing and causing problems, or you get a simple viral infection that otherwise a person would recover in 5 or 7 days, They now take 10, 15, 20 days to recover because the air pollution has added inflammation on their respiratory system. These become the common and obvious symptoms, but even having fatigue, tiredness, headaches, feeling lethargy can sometimes be present in very highly polluted areas. And when we look at the impact, as I said, on other organ systems, feeling down, low, anxious, depressed, in people who are predisposed, also in the elderly, having a cough when they wake up in the morning, having increased phlegm production. The symptoms can be very, very widespread. They have even associated very high pollution levels with increased risk of heart attacks and strokes in people who already have existing risk factors or predisposing factors to getting such kind of problems. So once again, the effects are very widespread, and here we are talking largely about outdoor air pollution, but indoor air pollution also would have a similar impact on a person's health, depending on the sources of the air pollution and what the types of pollutants are. So when we talk about outdoor air pollution, which is primarily what we are talking about right now, there are several different things that are measured and believed to have a bad impact on health. Amongst these, there is something called particulate matter. Particulate matter is abbreviated as PM, and 2.5, 5 and 10, which is the micron size of these particles, is what is measured in the air. Also, when we look at gaseous air pollutants, again outdoor gaseous air pollutants, there is nitrogen dioxide, there is sulfur dioxide, there's carbon monoxide, and then there is ozone. Now when we take these 6 or 7 main outdoor air pollutants and we look at what the World Health Organization standards are for what is called ambient air quality, we as in India are, as we know, have some of the most polluted cities in the world. In fact, amongst the top 20 most polluted cities in the world, 7 to 10 happen to be from India almost every year that these rankings are released. Now when we talk about Mumbai city, just for example, today the AQI of Mumbai is around 180. This AQI should ideally be below 50 or 40, depending on what criteria or what particulate matter you're looking at. So for PM 2.5, the standards for India set by the Indian ambient air quality standards is less than 40. For the world, the standard set is less than 10 or even less than 5. And today, when we look at the PM 2.5 levels in Mumbai, the level is above 60 or 65. So by international standards, we are 6 times higher. By Indian standards, we are 1.5 to 2 times higher. Every level that goes above is a major concern. When we look at the AQI of Mumbai at this time of the year, it has never risen to these levels in the past year, and there are many reasons behind this, including a sudden drop in humidity of the monsoon stop, the change in the air transfer patterns or airflow patterns, the increasing heat. The smog levels have been at an unusual level, which we would normally see after Diwali in most years. When we look at carbon monoxide, because this is another very important pollutant, the standards set even in India are between 2 and 4. And the level that I noted on the monitoring sites, the air pollution monitoring sites, say that the carbon monoxide level in Mumbai is above 600. That's an unbelievably high level. When we look at the PM 2.5 level, even a week ago, it was crossing 250. Again, remember the level should be less than 40 by Indian standards and less than 10 or 5 by the world standards. So there are a lot of pollutants and they are at phenomenally high levels these days, and we all need to be very careful about it. So when we talk about protecting ourselves from outdoor air pollution effects, remember we are primarily talking about that today. We have to realize that a lot of people like to do morning activities at 5 a.m., 6 a.m., 7 a.m., 8 a.m. These are the times of the day when the smog levels, the air pollutant levels are at their highest because they have kind of settled down as it has become cooler during the night. And in that situation, if a person goes out and exercises in any form, whether it's yoga, pranayam, running, jogging, physical exercise, any of kind, okay, when you exercise, you increase your respiratory rate, so you take in more air and exchange more oxygen. So that would be a bad time of the day to do physical activity before the sun rises, because once the sun rises and the heat level increases, these pollutants then move upwards with the warm air. And so preferring to do your physical activity maybe after 8:30 or 9 in the morning, if that is practical and doable, would be one option. The second option would be to do your exercise or activities indoor, but again you have to make sure that your indoor air quality is not directly impacted by the outdoor air quality. So in an air conditioned room, preferably with a closed room where you can have a good quality air purifier that has multiple levels of filtration going on, maybe a safer time in the morning time to do your exercise. Now do the same thing in the afternoon or evening, you may be better off. So one, tracking your air pollution levels in your area and making sure you're not doing too much outdoors at those times where it is possible or practical. The second thing that we can do is making sure that inside our homes or inside our offices we reduce the sources of air pollution. So burning combustible fuel, not having good air ventilation, using a lot of strong smell containing substances, varnishes, paints, burning things, even things like agarbatti, dhoop, which can add to the indoor air pollution, so that we are not adding a second problem onto the first problem. Each individual needs to realize that air pollution is not only something that can be blamed on the administration or the government or anyone else. It's our individual responsibility. So the more we carpool and we use less of our individual cars, we are producing less combustible fuel that is adding to the air pollution. The more we walk where we can, rather than taking our two-wheelers or four-wheelers, we are reducing air pollution. The less we use electricity, which most of it, remember, comes from coal burning, we are reducing the impact on the outdoor air pollution. And similarly, all of the industries and the regulation that needs to go into, which the government of India is working on, with all the different parameters that have been set for the world for 2025, for 2030, for 2050, all of that together will reduce the impact of this air pollution on our health. Once we recognize our individual contribution to the carbon footprint, to global warming, we can certainly all take steps, and I would suggest that you all see the videos or the posts that I have done on this in the past around World Environment Day and other such places, to see what individuals can do to reduce their contribution to the global warming, to the air pollution, and to the carbon footprint we are leaving on Earth. So I think it's part government, part individual. A lot of things can be done. Wearing a normal mask can only cut out the particulate matter, which is very relevant, because in a city like Mumbai, it has been found that PM10 levels have been extremely high with the amount of construction that's going on and with the smog and the changes in the environment that are there. And in this, the air masks can help. Surgical masks to a lesser extent, an N95 mask or a KN95 mask even more, but where it is practical and possible, and those who have already existing lung conditions can certainly benefit from using these masks, because not only it's air pollution effect that is reduced, but also their risk of catching infections, viral infections, bacterial infections, and all the other infections that are there in the community at different times of the year are reduced when people wear masks, especially in public places and crowded places amongst other people. So these are some practical things that we can certainly do to reduce the impact of air pollution on ourselves, on our families, and also in general.